Okay, this is a continuation of the talk from mouth to mitochondria. Parts 1 and 2 were mouth and gut. Now today we're doing liver and spleen. Okay, there's a few things worth knowing about it. The liver is connected by, the bowel has mesenteric veins. Mesentery means in the abdomen to the bowel. And it travels up through the mesenteric veins into the portal vein. And the portal vein goes into the liver. Okay, and then the blood is mixed throughout the liver through what are called sinusoids. It basically percolates through the liver. And the liver is the metabolic workhorse of the body that processes everything. It maintains a normal blood glucose level to keep the brain happy, and then it detoxifies everything else and puts it into packages, like to send it around in lipoprotein carriers for the fat. It is connected by the splenic vein to the spleen. So when you get fibrosis of the liver with cirrhosis, you'll get back pressure into the spleen will enlarge. Okay. That'd be called splenomegaly. The spleen's job is, the spleen is like the graveyard of the red blood cell. Typical red blood cell lasts about 120 days. Typical red blood cell is about 7 microns in diameter. A peripheral capillary is about 5 microns in diameter. In the spleen, it'll be about 3 microns. So as the red blood cells get stiffer as they get older, progressing towards 120 days. They get more glycated on their outer surface. They get more phosphatidylserine externalization of a phospholipid from the internal leaflet of the plasma membrane to the external leaflet, and that makes them stiffer, less deformable, and then they get removed by these tight filtration-like capillary sinusoids. Okay, it's like a filter to remove red blood cells in 120 days. Okay, now here's what I see every day, and this is fatty liver. Okay, so here is your typical fatty liver on ultrasound. The fat's more echogenic than is the water in the kidney cortical parenchyma, so it'll be hyperechoic relative to the kidney, and that by definition is fatty liver. Okay. This is so common that if you hear the history, the patient has elevated LFTs, liver function test, you can safely assume it's a fatty liver about 99% of the time. There's other things that can do it, but that's what it almost always is. Okay, and I also have seen most of the patients with kidney stones, the vast majority of them, they've got a fatty liver. They go together. These are all part of the high-fat diet, Western diseases. Okay, here's the appearance on CAT scan, whereby CAT scan is all based on density, and ultrasound is based on echogenicity. Okay, so the liver was hyperechoic, because fat's hyperechoic, bounces more sound back. But with regard to density, fat is less dense than water. Fat will float on water. So the liver becomes less dense than the spleen. That's fatty liver, when the liver is less dense than the spleen. Okay, and this is like a classic fatty liver. You see the slightly branching densities of the blood vessels, the portal vein and its branches. Okay, super common, and this basically means diabetes of the liver. Okay, here's a patient with a kidney stone. It's obstructing the left renal pelvis here, causing hydronephrosis, backup obstruction. One can see that the liver is less dense than the spleen, consistent with fatty liver. Okay, and again, that's diabetes of the liver. That's like the Van Halen song, I think that you're headed for a whole lot of trouble. So this patient's just going to get sicker and sicker unless they turn their act around. You can see they're developing dish, branching osteophytes going all the way up and down the spine because of degenerative disc disease due to ischemia, due to atherosclerosis, which is a secondary subsequent finding from diabetes. So this is just sort of classic, typical stuff. This stuff is so common, I'd expect to see it. I would not even, think twice about it. Like if I got a phone call from a resident, oh, we got a patient on the table, 60 years old, we're having a little trouble with something, can you come help us out? I wouldn't even look in the chart. I would automatically assume the patient's hypertensive, they're diabetic, and they have coronary artery disease. That would be a safe assumption, no matter what the procedure, no matter what the situation is. Any 60-year-old in the Western world, those are safe assumptions. They probably have those diseases. High fructose corn syrup is high fructose corn syrup. The fructose is processed differently than the glucose. Glucose is meticulously regulated by the liver because it has to maintain blood glucose for the brain, whereas fructose just kind of can come in as a bolus and be made into fat. So high fructose diet is predisposed to fatty liver. They also elevate uric acid in the blood. Okay, you can have some liver toxins. Oops, I meant to go back the other way. Go to previous slide. This was Jeff Nelson over at VegSource and his wife. She had a toxic reaction to rooibos tea. And some of these herbal teas are very dangerous. They, here, let me make sure I'm out of the way. Some of these herbal teas are real dangerous, and they can cause liver failure. She luckily, got it caught early, and so it was reversed. But, I remember seeing in residency, some patients' liver failure from these herbal teas. And when I was in when I was in college at Stanford, my botany professor, he said, don't ever drink herbal teas. You don't know what's really in them, and some of these things are toxic to the liver. So, it's rare, but I have seen a couple cases of liver failure from that reason. Okay, saturated fat progressing around. It begins in the skeletal muscles. That's the first location of excess fat storage in the setting of diabetes, and that'll give you postprandial hyperglycemia. You'll have insulin resistance leading to high blood glucose after eating. Postprandial means after eating. With time, more fat gets stored in the liver, so now you have a fatty liver, and then the liver loses its ability to effectively measure blood glucose level, and it tends to keep pushing too much glucose into the blood. So now you'll have hyperglycemia, high blood glucose level, even when you're fasting. So this is the next stage of diabetes. Eventually, fat will continue to accumulate in the head of the pancreas. It'll destroy the beta cells of the pancreas. The beta cells are the ones that make insulin. So then you're going to have beta cell failure, and then you're going to become insulin-dependent diabetic. And you can see that on a CAT scan of the abdomen. You'll see fatty replacement of the pancreas parenchyma tissue. Fatty atrophy of the pancreas is called. And you get all the diabetes complications. So the good news is, how do you treat it? Actually, I'll come to this other slide next, because this is actually a bigger topic. Let me get myself out of here. All right, let me just show you what I wanted to show you first. I'm going to come back to this slide. So here's a fatty liver. Yellow is sort of the color for fat, baseline fatty liver. If the patient lost 30 pounds or more, this is the work of Roy Taylor. He found these are people who had type 2 diabetes of 4 years duration or less. As soon as they lost the fat, their fatty liver went away. The fat mobilized from their body, first from the liver, and they lost all the weight and they were cured. So this was a fatty liver on a special type of MRI to measure the fat in the liver. When the fat went away, fatty liver went away, okay? Causes of fatty liver: high fat diets, excessive high fructose corn syrup, drinking alcohol, glyphosate on non-organic foods. It's not just on non-organic soy, it's on like 70 different non-organic foods, so you'll want to be organic only. Fatty liver means metabolic syndrome, prediabetes, diabetes. It's so common. The vast majority of Americans over 55, they have fatty liver. And what does it mean? It means the patient's screwing up, eating a bad diet. It starts out as NAFL, non-alcoholic fatty liver. Then it becomes NASH, non-alcoholic steatohepatitis. There's like inflammation now, cirrhosis, and then they potentially get a transplant. Sometimes they get cancer. Okay, and so what I'm saying is a typical Western world patient tries to treat their fatty liver with a Mediterranean diet, which is totally stupid. That allows alcohol, oil, nuts, seeds, chicken, fish. Totally stupid. They're told to exercise more, and that's not good enough. Okay, they're given medicines like statin, that's a mitochondria inhibitor, and metformin, another mitochondria inhibitor. And then they don't get better. They have fatty liver at follow-up. Okay, but what I wanted to show you, I think that's the last slide, but let's go back to that slide. Here's the one I want you to see, because this one's valuable. Remember, if you saw my previous lecture when I did the gut and I talked about the esophagus, inflammation is heart disease, then chronic inflammation leads to fibrosis. Fibrosis is laying down a collagen scar tissue, and then that traps some normal cells in it, and the trap then creates hypoxia in some of those cells because they're enveloped in the scar tissue and the collagen fibrosis. They don't get enough oxygen, and that hypoxic tissue, meaning deficient in oxygen, can undergo a Warburg effect, which means injury to the mitochondria due to the lack of oxygen, because the mitochondria, to run oxidative metabolism, they rely on oxygen. So when you're deficient in oxygen, you can get what's like the Warburg effect. Otto Warburg, German biochemist, Nobel Prize, 1931, that if mitochondria of a cell are deprived of oxygen, the cell will sometimes revert to a primitive mode of metabolism, anaerobic glycolysis, like an anaerobic bacteria, and become cancerous. So here's this progression of events in the liver. And again, trust me, that's a super useful concept. You start out with acute inflammation for whatever the reason. It progresses to become chronic, and then part of chronic inflammation is scar tissue, laying down fibrosis, which means collagen, and that trapping some normal cells in it. And those trapped cells become hypoxic, far from the arterial capillaries, so they don't get enough oxygen, and then they can transform into cancer sometimes. So the typical progression in the liver, you start out with a normal liver. Person's eating a high-fat diet, they end up with a NAFL, non-alcoholic fatty liver. That over time progresses to NASH, non-alcoholic steatohepatitis. Then you start developing more and more fibrosis. Eventually you fibrose the whole liver. That's cirrhosis. So normal residual liver cells get caught in the fibrosis, trapped in it, and made hypoxic. And some of them might turn into cancer. And that's liver cancer, hepatocellular carcinoma. And this can occur from alcoholic cirrhosis. It can occur from hepatitis-related cirrhosis, hepatitis C, hepatitis B typically. So anyways, what's the smart move? Eat low-fat vegan diet with no oil, no alcohol, and live happily ever after and protect your liver. Okay, I hope you found that helpful.